Siltussin Dm is a combination medication used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. Guaifenesin, one of the ingredients, works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. The other ingredient, Dextromethorphan, acts on a part of the brain to reduce the urge to cough. It is important to read the package instructions carefully before using this product, especially if you are self-treating. This medication is not recommended for children younger than 6 years old, and some products are not recommended for use in children younger than 12 years old. It's essential to follow all dosage directions to decrease the risk for serious side effects. It's also important not to use this product to make a child sleepy and to avoid giving other cough and cold medications that might contain the same or similar ingredients without consulting a doctor or pharmacist. When taking Siltussin Dm, make sure to follow the directions provided by your doctor or on the product package. It can be taken with or without food, and it's important to drink plenty of fluids to help break up mucus and clear congestion. The dosage of Siltussin Dm is based on your age, medical condition, and how you respond to the treatment. It's crucial not to increase the dosage or take it more often than directed. If you are using the liquid form, use a special measuring device to ensure you get the correct dose. For powder packets, empty the entire contents onto your tongue and swallow, and for capsules, swallow the whole capsule. It's important to note that abusing this medication can result in serious harm, such as brain damage, seizures, or even death. Do not increase your dose, take it more often, or use it for a longer time than directed. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or worsens after 7 days, it's important to contact your doctor. These could be signs of a serious medical problem, and you should seek medical help right away if you think you may have a serious issue. Some common side effects of Siltussin Dm include dizziness, drowsiness, nausea, and vomiting. If these effects persist or worsen, it's important to notify your doctor or pharmacist. However, many people using this medication do not experience serious side effects, as the benefit to you is greater than the risk of side effects. It's important to be aware of the possibility of a very serious allergic reaction, which is rare. Seek medical help right away if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the daily dosage and optimal timing, it's important to follow your doctor's instructions. If you have any concerns about the side effects or usage of Siltussin Dm, don't hesitate to reach out to your healthcare provider for further guidance. Before taking Siltussin Dm, make sure to inform your doctor if you are allergic to Guaifenesin or Dextromethorphan, or if you have any other allergies. Also, let them know about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. This medication may cause dizziness or drowsiness. Avoid alcohol or marijuana, as it can increase these effects. Do not drive or operate machinery until you know how this medication affects you. If you have diabetes, liver disease, or any other condition that requires you to limit sugar or alcohol, speak to your doctor before using this product. If you have phenylketonuria, PKU, or need to restrict your intake of aspartame, consult your doctor before using the liquid forms or powder packets of this medication. Before undergoing surgery, inform your doctor about all the medications you are taking. During pregnancy, use this medication only if clearly needed and discuss the risks and benefits with your doctor. It is not known if Guaifenesin or Dextromethorphan passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that may affect how Siltussin Dm works in your body and could increase your risk for serious side effects. Always keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors, such as isocarboxazid, metaxalone, methylene blue, and others, while using Siltussin Dm, as it may cause a serious and possibly fatal drug interaction. It's also important to ask your doctor when to start or stop taking this medication if you are using MAO inhibitors. Be cautious of interacting with other medications such as rolapitant, and always check the labels of your medications to avoid taking more than one product containing Guaifenesin or Dextromethorphan, which are the active ingredients in Siltussin Dm. Additionally, Guaifenesin may interfere with certain lab tests, so make sure that the lab personnel and all your doctors are aware that you are using this medication. Always follow your doctor's instructions and discuss any concerns or questions you may have about taking Siltussin Dm. If you or someone else has taken too much Siltussin Dm and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. If your doctor has prescribed Siltussin Dm, it's important not to share this medication with others. Make sure to attend all medical and lab appointments as directed. If you forget to take a dose of Siltussin Dm, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Siltussin Dm, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid forms of this medication. Different brands may have different storage requirements, so it's best to check the product package for specific instructions or ask your pharmacist for guidance. Keep all medications out of reach of children and pets. When it comes to discarding Siltussin Dm, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Properly dispose of this product when it is expired or no longer needed, and consider consulting your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.